health informatics, that's a term that gets thrown out a lot, but not necessarily one that most people understand. What are some of the things that you're working on within health informatics?
Oh, great question. And I appreciate that was actually a compliment saying that the term health informatics gets thrown out a lot because I think one of the major problems that we have is that it doesn't get thrown out enough. And when it does, we have this huge visibility problem where people don't understand what it is. And as a discipline, it's very diverse. So within, if you say you're a physiotherapist, usually you don't have to actually explain what it is you do, even though a physiotherapist does really different things, whether they're working with elite athletes or infant babies. But people have an idea of that. When you say you do health informatics, most people go, okay then, it's the way to kill the conversation in the bar on a Friday night. But look, what health informatics is actually about is it's really basic. It's what you would, if we invented it today, it would be called digital health. And it's really looking at how we manage information in healthcare to improve health outcomes. And of course, it's 2013. It's just disgraceful that we're doing that using bits of paper and post-it notes, not using computers. So even though it's obviously about technology, that's only because technology is the medium in 2013 that we should be using. But it's really about how we manage information.
And what are you excited about in this field?
Oh, I'm excited about the future. So health informatics has actually been around a really long time. And usually the people who are attracted to it are like me, they have a clinical background. I trained as an occupational therapist. So usually people come in and they have a health background or they're the IT geeks as well. And also healthcare management and healthcare administration, and usually it's a field that people fall into because of the injustices that they see in their daily work life in hospitals and in community care. So even though it has that diversity and it's got a long background, it used to be centred very much in acute centres, like a lot of healthcare. There's a lot more interest in what was happening in hospitals. It was really only 10 years ago or so that we started talking about chronic care, which seems crazy because if you've got a chronic disease, you're the frequent flyer of the healthcare system, not the guy who broke his leg or had a car accident last night. So, but the future of health informatics, even though it started in that very much acute hospital-based sector, the future is incredibly diverse. So quantified self, that wasn't a thing a few years ago, like no one had heard of that. And now that's part of health informatics because it's the way we manage information in healthcare. And with the quantified self stuff, that's actually information that's usually generated by the self, by the individual, by the patient. And so now that a health informatics person can actually help research how do we design those things, how do we design the workflows, what sort of information should we be collecting, for what purpose, and then once we have that information or data, how do we actually use it to improve health outcomes.
And you brought up the role of the patient. Can you talk a little bit more about how a patient can contribute to health informatics?
Yeah, it's because it's a scientific discipline. It suffers from the same problems that medicine has in general, where the patient voice hasn't been heard. I think one of the differences, though, and the value I think you would find it hard pressed to find a health informatician who actually didn't value the patient voice, because we're system thinkers and we see things through a socio-technical lens. So you couldn't do that by only seeing one perspective. So we're actually taught to actually see multiple perspectives and to be able to sort of interpret those perspectives. So we need to be able to understand as best we can where the patient's coming from, what's important to them. We also need to be able to speak the language of the doctors and the nurses and the allied health. And we also need to be able to speak technical geek stuff as well. And we sort of act like the translator between all those three worlds and bring them together, always with the goal of improving health outcomes for people.
And what have you found is a good way to understand the patient perspective?
It's really easy. Listen. Yeah, it's really simple. As an occupational therapist, we get trained, we use words like empathy and holism, like looking at the individual as a whole, and not just you as a whole physical being, rather than just your broken leg. But when we say we look at you holistically, we want to know what's going on in your mind, what you're thinking about, what your concerns with. We want to know your home situation. Who do you live with? Do you live on your own? What's your social circumstances like? And the reason that would be important for an occupational therapist is because our job is to make sure that with whatever sort of functional disability you have at the time of why you're seeing us, it's our job to get you functioning as best as possible in your world. And so if your bedroom is on the first floor of your apartment and you've got stairs and your legs don't work for a while, it's our job to work out how you have to manage your daily life in that situation. So for us, we have to listen, and we have to be really empathetic and really understanding where that person's social context as well as their physical presence and the mental stuff. And I think in medicine that does, like you said, it does get missed. And I empathise with doctors, and I understand why medicine is taught that way, because I think being a masculine field as well, maybe it's also we're very, if you've got a trauma patient that comes in, the decisions you're going to make, maybe in the first few seconds, if not minutes, are going to determine whether this person lives or die. You don't actually have time or the headspace to actually think about them as a human being. Like, you just have to work out how to get their heart started again. So I actually understand why medicine has been taught to see people as the disease or as the diagnosis, but it's medicine is changing the way we practice medicine, so we also have to change the way we think about patients. And I'm sure it will happen, and there is lots of wonderful doctors and wonderful medical educators bringing that into their practice. It's just taking a while.